Key techniques. In this section, we're going to be looking at the 4 key techniques that we'll use when foam rolling on the grid. The 4 key techniques are rolling, spanning, cross frictions, and mobilisations. And knowing the different ways in which we can use each one will change subtly the effects that foam rolling have on our clients. The first of our key techniques is rolling. To illustrate this, I'm going to roll the front of my thigh. You have 3 options when rolling. The first is a complete pass along the length of the muscle. In this case, I would go from just above the knee to just below the hip and then all the way back up again. The second option is to divide the muscle into sections. So I would first roll the first third or half of the thigh back down to the knee. Once I completed the required number of passes, I would then move, adjust my position, and roll the second or next section of the muscle until the whole muscle had been addressed. The third option is called inching, and it's where we come up a couple of inches, back down slightly, and we gradually alternate a forwards and backward movement, but slowly progressing across the length of the muscle so that we move from one end to the other with a focus on each area that we pass. Again, just to highlight, some muscles will be slightly more tense or slightly more inflamed than others, and for that reason it's always important to make sure that a sense of discomfort at most is felt by the person foam rolling and not any pain. The second of our key techniques is called spanning, and this is a horizontal movement across the length of the muscle. Again, I'm going to use the quad as the example in this instance. Assuming that you've completed your rolls or you're using this as a midpoint and on a particular area of tension that you found, you then stop and slowly lift and roll sideways across the muscle. So if we look at that from the other side, what I'm doing here is I'm lifting the hip and the knee off the floor to create that sideways rolling motion across the surface of the roller. Another point that's worth remembering is always make sure that the pressure is as near to the center of the roller as possible, as that reduces the risk that you'll fall off. The third of our key techniques are cross frictions. These are similar to spans in that they're performed at 90 degrees to the line of the muscle. However, the pressure is on a constant area rather than a varied area. To illustrate this, I'm going to do the lower leg. So again, assuming that I perform my rolls first, cross frictions would be performed like this, where I'm dragging the target area across the top of the roller, but the pressure is constant, whereas a span would involve a rotation and the pressure would change. So here the pressure is on the inside of my soleus, here the pressure is on the outside of my soleus, here the pressure is on the middle. In a cross friction, pressure is on the middle here. I pull, I create lateral tension across the fibers, but the pressure is still on the center of the soleus. I then pull the opposite direction, again keeping that downward pressure so that it's still on the same area that I'm targeting, but the orientation of the foot and the orientation of the muscle are still exactly the same. The last of our key techniques is mobilisations. This is where movement is created at the distal joint after the muscle or area of pressure that we're using the foam roller for. Using the example of quads again, assuming that I've completed my rolls, any spans, any cross frictions, I would then find the point of greatest pressure or discomfort, pause on it, and in this case, I would bend the knee and relax. when performing mobilizations, it's key to make sure that you let the muscle relax and therefore allow the pressure of the roller to do its work. I may roll, check, move slightly, perform a repeated movement or mobilization in another area, or I may choose to stay on the same area and focus. As with all of the techniques, I can increase or decrease the pressure by changing how much support I give to the other limbs. Mobilizations tend to be very, very uncomfortable, particularly on sensitive tissue. So it's important to make sure that you incrementally increase the range of movement that you apply at a particular joint.